Hey guys, welcome to my presentation on ultrasound guided arterial blood gas sampling. So some indications for using the ultrasound to obtain your blood gas are prior failed attempts, faint or weak pulses, or a patient with known or suspected difficult access, such as IV drug users, dialysis patients, hypotensive, dehydrated patients, coagulopathic patients, peds, or obese or edematous patients. The contraindications are pretty much the same as a regular blood gas, such as if your patient fails an Allen's test, you shouldn't puncture through a lesion or close to a shunt, burn, infection, or injury, and just keep in mind if your patient's on a lot of blood thinners or like thrombolytics. So for the procedure, you want to use universal precautions, aseptic technique, make sure everything's clean, choose your site, consider all your contraindications. If you're down at the radial artery, make sure they pass an Allen's test. Um, and then you can use an anesthetic if you want. And then once you're ready to puncture, or once you've found the vessel using the ultrasound, you use that to guide your needle. And then once you think you're in, you just look down and make sure you have a flash and your syringe is filling up. So the equipment we use here are the Sonosite Export and the Sonosite PX. I put more pictures of the PX because the power button's kind of hiding here on the back, and the screen controls are a little bit different on the PX. The Export's probably the more popular one we use, and the power button is pretty obvious on this. It's just right down on the screen right here. So the transducers, we're using linear array transducers. This gives us a nice square image, and it's ideal for finding vessels. So this is what it looks like on the export. It is the 13.6 L25, and then on the PX, it's the 19.5. And then this is just the ultrasound gel we commonly use. You can also just use lube. I've seen some of the doctors use. I guess that works good as well. So some features the ultrasound gives us the normal 2D view. There's a Doppler view that displays any type of movement in the vessels, and this can be used as at the same time as other modes, such as the color mode, which shows presence or velocity of the blood flow. These can actually all be used at the same time. The most important step for me, and I think everyone should use, is the center line or needle guide. I believe on the export it's called needle guide, and then on the PX it's center line. And you can turn that on just on the options page. Then there's auto gain adjust, which helps you brighten up the image, and then you can also zoom. And then there's the res, gen, or pen options. So res gives the best possible. Sorry, this is supposed to say resolution. Gen is supposed to provide a balance between the best resolution and best penetration display. And then penetration provides the best possible view for penetration. So startup screen. This is what it looks like on the export. Actually, it looks pretty much the same on both. They both look like this. And the first thing you're going to want to do is select your transducer. So on the export, again, you want to use this L25. And if you look at the display in the picture, you can see that it's a square right here versus this conal shape on the other one. Then on the PX, you select this L19.5 here. And again, this one's got the square. So this is what the main screen looks like on the export. You can see here you got your zoom or your res gen. And then here on the left is the TD mode, the Doppler mode, and the color mode. And then the more controls is right here. So when you hit more controls, this window pops up. and this is where the needle guide is, and that's going to put a straight line down your visual display here, which aligns with the center line marked on the transducer. So, oh, and then you also have a center line reading here, which is, I believe, a solid line all the way down, but I would suggest using the needle guide. It's just my preference, but it works well. And this is what the main screen looks like on the PX, the smaller ultrasound machine. Here you can see you have ResGen on the main screen, and then on this one you have the center line option right there, and then more controls is right here. You hit more controls, and then this box pops up. Um, Again, there's the center line. I don't really use many of these other options on this ultrasound device, but I do want to go down here and look at the actual physical buttons you can have. You can select your depth right here and adjust the gain on the picture. And there's color mode, um, and Doppler mode, and sorry, I think just the main mode, the 2D mode. So here on the left is what your display looks like before you activate the needle guide, and then this is what the needle guide looks like, this array of dots going straight down the center. So to locate an artery with the needle guide, um, this is what you'll kind of see once you're using the ultrasound on the site, and you're looking for a black circle like you can see here, and you should see it pulsing, and it should look something like this. That kind of blinking going on there. Once you see that's your artery. Um, if you're having a difficult time finding it, you can either lighten your pressure on the transducer, or maybe even push it down. Can help exaggerate the visual here. And then once you penetrate with the needle, you can't see the needles we use on the ultrasound, but you'll still see the tissue moving along it. And then you'll see a little dip in the top of the circle once you hit that artery. So in Doppler mode, um, I didn't get it on this slide, but there's a little touch screen where you can move this box around and pinpoint where you want to focus in Doppler mode. And you just click the play button, and you'll hear this pulsing once you find the artery. Just like the standalone Dopplers we use. And then color mode, pretty much the same thing. You can use that slider and kind of pinpoint where you want it to work on the screen, and then you would push play on the ultrasound, and it will go according with the pulse, and that just helps you verify that that's the artery you're hitting or seeing. Complications, there's pretty much no complications using the ultrasound, just the standard complications that go along with obtaining a blood gas, such as hematoma, arteriospasm, air clotted blood emboli, contagion, hemorrhage, trauma to the vessel, things like that. And that's it. Thanks, guys.